Loyola has a really strong reputation of training excellent clinicians, caring, empathetic physicians who are also clinically very sound. And I think the STEM Center really represents Loyola's commitment to that. Loyola wants to make sure that every student has been exposed to certain things, certain physical exam findings, for me, maybe certain murmurs or cardiac exam findings. And the STEM Center allows me to guarantee that every student is going to be exposed to those things during their time of training. One of the things I love about simulation for medical students is it allows us to do the physical exam without throwing them into the environment where they're the bottom of the totem pole. So sometimes I find that when students are on the rotations with me and there's a fellow and a bunch of residents, they're kind of afraid to ask the questions for something that they think might be basic. Now, in reality, most of the team would probably benefit from talking about these murmurs. But when I'm teaching with Harvey, I'm allowed to really focus on the level where the students are right now. So the Harvey sessions are really important for solidifying our physical exam knowledge. As a cardiologist, I don't think about listening to murmurs in isolation. I think about how does the murmur correspond with the entire clinical picture. And Harvey allows us to do that. In a small picture, it allows us to look at how respiratory variation or changes in heart rate might affect a murmur. But in the larger context, it really allows me to teach murmurs in a clinical scenario. I can introduce Harvey as a different type of patient, and students may understand the murmur a little bit better when they're actually thinking about it in a clinical context. Did you hear S1? Hear S2? Yeah, so like we talked about with that inching technique, as we move across the chest wall, the S1 and the S2 are going to flip. So exactly, you heard the change in intensity here. Now let's listen down over the PMI. What changed? What do we hear here? Murmur, yes. But this is really the first time that we can allow everybody to do an exam at the same time together. Right? When I teach on the wards, it's one at a time. When we listen to internet clips, it's kind of one thing at a time, whereas this allows everybody to engage in the exam at the same time. All right. How would you describe this murmur? Harsh. All right, I'll take it. Do you hear any respiratory variation to it? It's a change with inspiration. To make this a little bit easier, I'm going to put the cone on Harvey so you can see him breathing. No. So there's no respiratory variation. So what side of the heart do we think this might be coming from? Perfect. Harvey allows me to take a general concept and apply it to a specific patient. And when students are first learning, it's important that we kind of clarify things in large concepts. But when I'm building a physician or training a physician, I want to make sure that they're really focused on the end game, focused on how am I going to help this patient sitting in front of me. And so Harvey puts a physical face on that. It allows students to take this preclinical education and really transition it to the wards. The other thing that I find is that students who are comfortable in sim feel comfortable with their physical exam findings, feel a lot more confident when they get to the wards. They're the students who have really participated in these Harvey sessions walk into the patients that they see in the hospital with a smile on their face and say, all right, I am going to listen to you right now. And that confidence really allows them to learn everything that I need them to learn when they're on the wards. I think it's really the most dynamic tool that I have for teaching the physical exam.